Today, I'm joined by Amir Rubin, an amazing human, founding partner at Healthier Capital, a venture firm investing in health tech to advance healthier outcomes for all. Most recently, Amir was the CEO of One Medical, where he helped triple the membership base in 7 years, shepherded the company through an IPO, led a hybrid primary care business through a global pandemic, and a $3.9 billion acquisition to Amazon.
Natalie, great to be with you. So pleased to be here today.
Well, Amir, my One Medical story just absolutely pales in comparison to yours. But I will tell you, it was truly one of the first and truly still one of the very few positive healthcare experiences that I had. This was early 2013. I remember booking a same day appointment with One Medical, and it completely rewired my expectations of what consumer healthcare should be like. And so I'd love to hear kind of what was your, prior to even joining One Medical as CEO, what was your first One Medical experience?
I had met the founder of One Medical, who I followed, and we were one of the first checks into it. We launched a little venture arm out of Stanford, and then years later, when he was ready to move on, I came in and for kind of half the life of the company was running it. And so, but for me, I picked up on these themes. Why can't we deliver a great care experience? It's supposed to be health care. It's more medical care, right? And so, how do we do health? How do we do care?
You've often talked about people and process, and kind of that combination can lead to transformation. So I'd love to hear a little bit more of that story.
Yeah, well, Natalie, I think to your general point, I think to make change or any kind of change, you have to align your purpose with your people and your process. And process, I'll include technology. And so, how badly do you want it? What is the purpose? What are you trying to achieve? And I think it often starts with that. And then, if you can start with that and say, we want to have the best patient experience anywhere, period, which I've used that line in several of the organizations I've worked with. Well, what would that mean? Well, it probably means we should think about every point of the touch point from before somebody sees us to after. Do you even know what that looks like? Have you gone into people's homes? Have you done the journey mapping on that? We did that. We did that at UCLA. We did it at Stanford. We did it at One Medical. Like, that's interesting. Do you think about what's the least amount of steps, clicks, calls, interactions? Do you measure those? Did you measure how many clicks it took a person to do something? Did you measure how many it took the provider? We did, and we'd set goals like reduce the clicks in half, reduce the time in half, for the sake of reducing it, right? Like, there wasn't a rev cycle goal around that or even a cost. It's like, it's going to be a better experience. And when I've looked at other great experience organizations and service organizations, they think about those things. Do you have an organization that ships code several times a day into operations and can deploy it? That's not easy to do. You have to build a different approach to do it. So actually, when you start with that purpose and you say, hey, we want to be the best experience anywhere, period, that ends up needing to drive alignment of people. It needs to have redesigned processes. It maybe needs different technologies. It maybe reprioritizes or prioritizes where you make your investments.
Well, what I'm hearing from what you're saying, frankly, reminds me a little bit of the Amazon customer centricity, customer obsession, measuring every click, every sort of touch point. And obviously, the stakes are higher when you're dealing with someone's health at One Medical. But I kind of hear that similar centricity on patient and making sure that the entire experience from end to end is really thoughtful. But I'd love to sort of like unpeel you say people, process, and purpose, completely understand on purpose. But in healthcare, and we see this with a number of our founders in the space, there's sometimes a tension between healthcare providers and engineers and folks that are coming up with the strategy. And how would you advise, a startup that is frankly working with very different types of people and cultures and ways of working? How do you create that cohesion so they're all working towards that singular purpose of better healthcare outcomes?
I like to say, like, we have a common mission and purpose, and we're all on the same team. And doesn't mean we don't have different roles and responsibilities, but the more we can look at things together holistically, doesn't mean we don't have things we need to solve for different stakeholders. We do, but the more we have a shot in hell of making a difference in this thing, if we're like, hey, that's not my problem, this is my problem over here, that gets a lot harder. So I'd say, how can one bring the different disciplines together? How could you have people looking at the problem together? Oh, you mean if I did this upstream, I'd save all this work for you downstream? And this is what we learned from kind of good process and lean and design thinking approaches. Yeah, like it's often the upstream things. Oh, that's easy. I can do that. Like sometimes it's not complicated. People just don't know. And I often find that nobody knows the end-to-end process in healthcare. Like certainly the end-to-end, like, but even within an organization, you find that most people, they're busy doing their work. But if we just take a little step back and say, oh, wow, this is the experience. And this is, I think, frankly, why, partially why startups exist and can do well, is it's very hard for incumbent organizations to step back from their existing day to day and redesign what it is they're doing more than incrementally. It's just difficult to do.
Yep. Yep. No, I think a lot of good first principle thinking of what's the end goal in mind, what's that purpose, and I'm with you. I mean, I think that's the beauty of technology startups is they're not dealing with the like mental overhead of this is the way things have been done. They can be really creative and agile in solving those problems. But like hats off to you, Amir. I mean, I think you were able to bring innovative thinking at Stanford, where you introduced video conferencing. You did it at UCLA. You did it at One Medical. And so I'm curious, as now in your new role as an investor, and you're evaluating startups and kind of what are you looking for, and where do you think there are opportunities where teams can be agile, can think very big picture on what's possible? What's exciting for you?
Yeah, I think broadly it's the intersection of the problem statements we have in healthcare, and maybe I'll talk a little bit about that, with the promise of what we can do with innovation. Whether it's innovative models, whether it's certainly AI and technology, but it's the marriage of those things. So I often start with the problems of the key stakeholders, and people don't want to buy AI per se; they want to buy a solution to the problem, right? Like, AI may be part of it. There may be an innovative business model, but so on the demand side of the world, I start with the consumer, the patient, the human, the person. Like, what are the problems they're facing? And we see all kinds of problems, but I'll summarize them briefly as access and experience kind of problems, right? Those are still it's very hard to get in. It's very hard to navigate. It's very hard to know where to go. The experience is choppy at best. And at some level, was somewhat the true north at One Medical. Like, wow, that's really a better experience. Yeah, we really focused on that. And also on the demand side, you have the people who are paying for things, whether it's the employer or the governmental payer, Medicare or Medicaid, or maybe the out-of-pocket. People are like, gosh, I'm paying a lot. Costs are going up. So there's those frustrations. And then on the supply side, we have frustrations, right? We have doctors, nurses, clinicians, techs, finding it challenging to manage workflow. We see rising burnout. We see workforce constraints. And then we see a challenge of how do we coordinate care? How do we build integrated networks of care? And I just saw a survey, something like 65% of patients say it's overwhelming to coordinate my care. So it takes about a month to get in anywhere.
When you're sick, Amir, like the last thing you want to do is coordinate care. It's tough.
It is tough. So as I recall one patient once telling me in one of my prior health systems, it's a full-time job being a patient here. It's like, well, and people have jobs and they have families. So those are the problems. Is summarizing. There's many others, but kind of it's what we like to start at Healthier Capital from the stakeholders and their problems, and ideally the solutions that we love are kind of win-win-win-win across the different stakeholders, not zero-sum games, but ideally ones where, hey, this can be a great consumer experience and it can fit into the employer or the insurance and the providers or clinicians like it, and it can help fit into the health ecosystem for more coordinated care. Because I do also think those can have the biggest impact and probably could be the biggest outcomes in terms of investments if they have that wide applicability.
Yep. Well, I think one thing that you've pointed to, and we've chatted about this in the past, is there's so much on the consumer to shoulder throughout finding care, being an advocate for their own care. And, I think what we've seen at Mavron is there's been such a movement among consumers to frankly quarterback their own health even more proactively. And I think this probably started pre-pandemic, but the pandemic was certainly a catalyst for people taking even more charge of their own health. I'd love to just kind of hear from you. I mean, did you see a change in kind of that proactiveness at One Medical? Or are you seeing it in the types of companies that you're backing? Kind of, do you continue to believe in this trend? But would love to kind of get your thoughts there.
I do believe in this trend, and I think it will persist for a few different reasons. I think, one, the existing ecosystem has a really hard time delivering access and affordability. It's not just the affordability. Like, you just can't get in, let alone to have a conversation about what do I need to do the next 5, 10, 15, 20 years, short of scheduling some preventive screenings, a mammogram or the like. Well, what if I have a family history? How do I know about that? What if I have BRCA1 or 2 or HER1 or 2 in my family? It's just hard for the ecosystem to do that. And so we do see individuals wanting to engage in their health. We also have some that don't have access, and those are challenges as well. So how do we reduce that friction? How do we reduce that cost? How do we make it really easy? We're investors in a company, now a combined company called Function Health, that combined with a company called Ezra, where basically a consumer can engage in the company and get direct-to-consumer lab work done, imaging work done. And I think over time, and genomics and other things, but over time, it's not just getting these things done in parallel. It's like, well, what's the combinatorial analysis of that? Given my family history, my medical record, my phenotypic data, my imaging data, my clinical lab results, my genomics, what does this mean for me? As opposed to get this screening at this age, get this screening at that age. Those are average distributions, which probably on average maybe say something, but for every individual are probably, not exactly the right thing. Well, given my history, maybe I should be screened earlier or later, more frequently. And these aren't magic bullets, but I do think it shows that you can't get this in the current system easily. It's not designed for that. The economic models aren't designed around it. The delivery system isn't designed around it. And it's not clear to me that the current institutions are going to be able to do that or have an economic model or a structure to do that. It's not that the good people in existing healthcare organizations don't understand that. They do. It's just not what they're often set up to do. So that was a long way to say, yes, I believe we'll continue to see this. Then there's the challenges of, and you're an expert in this arena, like, is this a good business? How do you acquire customers? What's the economic model? What does the marketplace look like? So, there's that kind of company specific question on this, but I think the problem statement is there. And we've seen it in other companies where the end point is a pill or a shot, right? Like, well, the consumerization of that's happened, whether it's GLP-1s or other wellness kind of approaches at Amazon One Medical. We also had a pharmacy business connected to that. So you do see consumers taking some of this into their hands, and some of that's fine, right? Like that's okay. So I think we will continue to see that. Maybe I'll make one final point here. With the rising out of pocket, the $7,000 somebody's shelling out for the premium with the great insurance and the couple thousand in deductible, and then their copay in their co-insurance, they're putting a few $1,000s out of pocket to use the insurance. So we're already in a state where people are paying for stuff and they're not loving the access. So I think alternatives could be appealing.
This is more qualitative, but the number of my friends and peer group that are using ChatGPT to self-diagnose or I would say light therapy in some cases, but just sort of that movement of having these LLM models sort of in your pocket where you can access them at any point in time. I don't know where it like leads us. And I think, for acute symptoms and acute health needs, you should see a doctor. But that behavior in the last, 6 to 12 months has been pretty profound.
No question. And these tools are pretty powerful. And, we've seen all kinds of reports come out and studies come out. There was one in Nature out of a model from Google called AMIE that showed kind of a differential diagnosis. The computer did it better than the provider, and actually the provider enhancing the model, like using the model with then a human in the loop, gave a worse answer, which was the provocative result there. And again, these are somewhat synthetic. Take a really weird case with really weird symptoms. Yes, the computer is going to be able to read all the books and kind of do the differential diagnosis better. But, why wouldn't we, as consumers, like try that? And frankly, for providers, why wouldn't the providers have some software that like sucks in all the data and says it could be one of these few different things? Now, again, what the humans are good at is like, well, what didn't Amir tell me? What isn't in the notes? Yep. It's not what isn't in the textbooks, and also it can answer like things that aren't known. Like there's a lot of clinical trials in cancer drugs, and there's uncertainties, and if it wasn't published or it wasn't in the book, it may not be there. But of course, we should be using these tools. There was another interesting paper from a colleague, John Ayers. This was a couple years ago now, and he's involved in one of our portfolio companies, Metaloop, and a agentic AI analytics platform. But John had this paper, and it showed, it got a lot of hullabaloo at the time that, yes, these chatbots can perform better than physicians in kind of the differential diagnosis. But then what was interesting is when patients were asked which one was more compassionate and had a higher service experience, the chatbot dramatically won, right?
Oh, wow.
Which was interesting. Yeah. But you think about it, like the doctor doesn't have time to say, Natalie, I'm so sorry to hear that. That must be terrible. Please accept my thoughts and emotions to you. And, tell me more about how this is making, like, they don't have time. They're like, take 2 Tylenol. That doesn't work. Go to ED. Call me.
Yeah, right? 1,000%.
But we can use these tools to augment the humans, right? And I think we should. So I absolutely think these are powerful tools. They need to be implemented safely with the right safeguards.
Sure.
But we're already seeing, we saw some challenges with lawsuits against ChatGPT. An unfortunate case of suicide of a young person was using ChatGPT for therapy. And, OpenAI has said, well, maybe in that chat, you can connect to a human.
Yep.
You've seen actually just last couple of weeks, Walmart said, hey, we're working on how you can do a chat and then purchase. Amazon's been thinking about this, right? This is the new Google search. It's going to be in a chat.
Totally.
And then maybe this is how you can then connect to a human. So again, you could, in a safer approach would be, hey, when you get to these guardrails, maybe you could refer it to a human. But I absolutely think these are pluses. I mean, what's the alternative? No access to anything, right? The alternative wasn't everybody's going to a human and getting therapy, unfortunately, right?
Completely.
The alternative might have been nothing, and it's hard to prove the counterfactual of what would be the case, um, but I think these are upon us and people are using them.
Yeah, no, I'm very excited about it, and it has been a great help to my personal life and inner life. So I'm an optimist here, and I think your point too on providers using these tools, and I mean my hope is that providers are able to use these tools to take away some of the more administrative burden, and they're able to focus on kind of really being with the patient and delivering care. And that brings me, I was reading your One Medical S1, which was phenomenal, touche. And one of the stats that I don't think gets really brought up, but was kind of striking to me, and this was back in 2019, so I imagine it's improved. But at that point, I think it was 47% of your members were engaging with One Medical on a monthly basis. I mean, and that's like if you're a consumer social app, that's a fantastic stat. I mean, but you're a healthcare company with very much patient centricity. And so I bring that up as I hope my real hope is that these AI tools allow patients to have, frankly, that One Medical type of engagement. But I'd love to just kind of chat on that piece of like, how did you guys do that? And like, it's just kind of an amazing feat, and truly it would be best in class with consumer social.
Well, I would say to get that kind of performance is the result of a number of things interacting together. So, starting where we started this conversation, first of all, we have a great experience and we're responsive and we build trust and relationships with people. So people say, hey, I'll go to this, right? Because it works and it gives me an answer. Like people, want to say, well, it's the app or the design, and that was all great and good. But, fundamentally, it works. We'll give you a response. It will be useful. It will be compassionate. It will be service oriented. Now, we absolutely had to build great tech around that to do that. And before Gen AI, we built an natural language processing NLP model that would basically read all these incoming messages, and then you could overwhelm our providers. So we would read it, and depending on the content, route it. Oh, you need a prescription renewal for this? Hey, this could be done under protocol. Oh, you need directions for that? This can be done. Oh, you need this prescription resubmitted over here? That can be done. So we didn't have to take the in-office provider time away. We also had staffed a national virtual team that worked 24/7, licensed in all states, not just to do synchronous telehealth, but they were doing asynchronous work. They were taking work off providers. So we had to build a staffing model around this. Then I think another thing that was really important is we built an economic model that at the margin, we didn't charge you for asking those questions. So, because today, if you interact with the health system, well, first of all, it would take you weeks. It actually takes about 31 days on average to get an appointment in the US with insurance. So A, it would take you a month, and then B, you'd have your $2,000 deductible, your $25 copay, and a co-insurance. So you're like, screw it, this just isn't worth it. So we were reducing the friction by having a great experience, by having a great tech platform, but also at the margin, not charging for a lot of those interactions. And we covered that kind of in a membership fee. So those kind of behavior design factors were important as well. And then we would do also a lot of outbound, right? And again, in a typical fee for service world, you wouldn't really know who your patients are until they cross your threshold. But in a membership subscription world, which is a lot more like, call it like an HMO-like world, we know who all the members are. We can do intake, we can risk stratify, we can do all these things, and we could use our technology to do that. And that means we can have outbound conversations, including something as simple as, hey, Amir, thanks for coming in last week. I just wanted to check in on how is your pain in your shoulder evolving, right? And that was automated. And and that's only advances that time. And then if I said I'm doing great, closed it out. If it said I'm doing worse, loops it back into the human. And they're like, wow, these people really care about me. But we had to build an ecosystem to be able to do that. So it was kind of multiple factors, from an experience model, a trust model, a technology model, an analytics model, and an economic model, and a staffing model to make that happen.
Yeah, no, well, very, like I said at the start of this, very appreciative of the model because it completely rewired my brain on how experiences should be for better or for worse. Because when I don't have a one medical like experience, I'm frustrated because I know it's possible. Um, well, you've mentioned a few times scaling empathy and kind of scaling compassion, and I think back to sort of some of the Howard Schultz isms that his focus was so much how do you scale human connection, and so one would love to kind of hear how did you do that in practice, and secondly, I think you've drawn on inspiration from other greats, frankly, not in healthcare, but in other industries, and would love to sort of hear where do you pull inspiration as you think about your leadership?
Yeah. Well, so the first part of the question, I'd say throughout my career, and certainly I'll call it at least my last 5 organizations, kind of use some common methodologies. Broadly, we call them CI Care, was a patient experience philosophy, really kind of crystallized during our time at UCLA, and then used them at Stanford, Optum, and One Medical. And even in my venture firm, we have a service ethos and standard, and we have the CI Care model. I can talk a little bit about that. And at some level, it started with, hey, this is important, and we want to have a great experience. And CI Care is also, simplistically, it's really the kind of an ethos and an overall philosophy, but it's also an acronym that says, here are the key things you should do when you engage with people. You should connect, and we might connect in different organizations, but maybe connect by calling them by their name or preferred name. And like often healthcare can be so dispassionate. It's not that the people are dispassionate. People, nurses and doctors, they've worked really hard, and they're, in general, I find amazing and caring people. But sometimes the passion has been beaten out of them, so to speak, through the process. So introduce yourself, and let's build two-way rapport here. We're both humans, and we're interacting on a human level. Communicate, CIC, communicate what you're going to do, how long it's going to take. Ask permission. Would it be all right? May I respond? R, to concerns, questions, anticipate questions. E, exit courteously, explain what happens next, and thank people. So at some level, we took these kind of general motherhood and apple pie kind of concepts that you've seen at a lot of great organizations in one way or another. And then we say, what does that mean at the front desk? What does that mean in billing? What does that mean in parking? What does it mean in the OR? What does it mean as a primary care physician? What does it mean in the PACU? What does it mean with the family members waiting? And so we actually went across, certainly did this in the big health systems, all of those various disciplines, and they came up with their CI Care best practices. We made training videos. We had standards. We trained on it. We then and did this throughout all the organizations. We had CI Care observation rounds. So then we go observe in the field regularly. Managers every week, the entire leadership team goes and observe others' departments. We did that every month, night shift, weekends, and see if it was happening. And then we give positive reinforcement and sometimes coaching. And then at Stanford, we then started posting the scores on the internet. We were some of the very first to do this. So you could look by provider at Stanford and see a scoring on a kind of 4 out of 5 stars kind of thing.
How did providers respond to that? I could imagine that, at first that might have been a tough meeting with your providers. How did you get them, on board?
A lot of relationship building over time. And the point is not to to shame anybody, but the point is to create an ecosystem where like experience matters. We care about it. We were focused on it. I'd say all of this was in the spirit of continuous improvement. I'm certainly not an expert on, frankly, anything, right? And like, I didn't claim that, I was the right answer. We also had teams of clinicians. And we evolved over time, and did the same at One Medical, in our different roles. And so you had to develop the standards. You have to train on them. You have to reinforce. You have to round on them. You have to observe them. You have to continuously improve. You have to build check-in mechanisms, metrics around these things. So, back to the second part of your question. Yeah, I've learned from a lot of great service organizations and brand organizations, and I've visited a lot through the years. Manufacturing organizations too, like a lot of lean process, like Amazon. Like you want it to perform consistently each and every time, always, and you have a human in this, and you're trying to deal with care and compassion. You kind of can't just wing it, right? You have to have some approaches, philosophies. And then it's really about execution. It's less about the secret sauce per se, and it's more about everything I just said is kind of known, right? In one way or another. The hard thing is, can you do it each and every time, always, now and forever? It's not an initiative. It's not this week's program. It's just foundational to what we do. And it's hard to sustain at scale. But that's why you have to build systems and tech and roles around it.
I think there's lessons and that early startups can sort of learn from the bigger corporations and bigger sort of health systems that you've been a part of, but also vice versa, where some of the bigger healthcare systems could learn from startups. I'd love to hear kind of, what do you think startups could learn from the One Medicals, the Optums, the Stanford Healthcare? What can they learn, and vice versa?
Yeah. Maybe I'll start with the Versa and then go to the Visa. I've just done a couple of board retreats for a couple big health systems and academic medical centers, and really this discussion of what we can learn from what's happening in industry and AI, and what does that mean for our healthcare organizations. And you've heard a lot of big companies declare, we're going to automate work. You've seen Amazon making some restructuring. You saw the Walmart CEO say, we're not going to hire basically any new people for 3 years. They're not saying they're not going to grow, right? Where AI is going to impact the work. You've seen this from, JP Morgan, from banks and others. Are you hiring no new people in your health system for 3 years? Do you have any strategy, any plan, any approach? And by the way, it already takes a month to get in. It's really hard to coordinate. You can't find the humans. The service experience isn't great. Like, do you have such a strategy? Where is your strategy to significantly redesign the way things work? And I think the incumbent organizations can see that from the startups, because at some level, the startups aren't constrained by the current state in quite the same way. Us investors may be willing to take a bet on them. It's quite risky. But, incumbents, I'm like, you spend money on some stupid stuff that doesn't work. You could spend worse money than trying some of this stuff out, right? Like, try it out. By the way, you don't have to pick the perfect company or startup or solution, and it may not exactly work. Or, as I sometimes say, look, use our solution. It'll only save you $10 to $20 million a year. And if you want to rip it out in 5 years, great. You only saved a couple $100 million or $100 million, right? But you have to start going on this journey. You're seeing what's happening in industry, and you're going to do nothing. You're just going to wait for what others do, or magically happens in the EMR so I can get my preventive health and my screening and my labor force automation. And that's not a dig on EMRs or anything. But so I think health systems, health plans can learn from startups and that mindset. I think what the startups can absolutely learn from healthcare, incumbent healthcare organizations. What, you think these people are idiots? They're super smart. You think they're very caring and compassionate. They're highly trained. Like, it's very hard to make change in healthcare. There's a reason why it's hard to make change. So understand the different payer categories, and they're different, right? Medicaid, Medicare, commercial insurance, Medicare Advantage, you name it, the insurance side, the benefits leaders, problem statements. Understand why things are the way they are. It's not just because they didn't think about like, hey, can we have better access or better service? They more than likely have thought about it. So what makes it hard to change? How can you navigate through that? What would it take to navigate through that? If you're trying to sell into them, why aren't they using your great solution? As I sometimes joke, these startups would come into our offices at Stanford and like, why aren't you idiots using this amazing thing? And I'm like, it integrates into nothing. I'm not sure it works. It's not HIPAA compliant. It's definitely not SOC 2. You actually have no sales, but besides that, it's great, right? Like the incumbents are not idiots. So that's also important to consider.
Well, you've mentioned a few times, changing healthcare is hard. And out of all the industries, Amir, you could have picked, you might have picked the most difficult one to transform. And I think you've said, there's no finish line. It is always evolving. And so I'd love, on kind of more of a personal note, how do you've looked at all sides of the Rubik's Cube here. You've been at Stanford Healthcare, you were at Optum, now you're an investor. How do you stay motivated with this like grand purpose and mission to make healthcare, more accessible and working for consumers? But it's a big mission that you've really dedicated your life work towards.
Well, at some level, I see things through health colored glasses. Like there's nothing more compelling than improving health and well-being. Like,
yeah, true.
And so, we have a long way to go. I've been working at it, and I can argue I've maybe, in the teams I've worked on, have made like some dents in that, but you could also argue like, heck, we have got a long way to go. So I find that very motivating. You can look at the numbers too. Obviously, we're spending close to $5 trillion and, approaching 20% of GDP just in the US.
Yep.
About 11% of global GDP spent on healthcare spending. So it's a big area. We all want it to work better.
Yep.
We want more access. We want more affordability. We want more longevity. We want more health span. And I think we can get it. I think we can get all those things. I mean, at some level, the fact that the health system doesn't work well is just creates the opportunity to make it work better, right? There is a big gap between the current state and I think what is very doable. Not easy to do, hard to do. Is this thing going to change the way we interact? I mean, 100%. I mean, we've got, just even in our own portfolio, we have a company, Hyro, that's conversational AI, contact center automation. It's in 45 health systems. Hi, how can I help you today? Like to book an appointment, right? Like integration to your EHR, into your phone systems. We talked about MetaLoop, agentic AI analytics. We have another company, Qualified Health, where you can build Gen AI apps on top of your electronic health record. Anywhere somebody's diving into a chart and comparing it to a standard, I'm looking for quality metrics, service standards. Is this patient eligible for inpatient admission? I have utilization management. The bots can do that. Coding, billing, documentation. We spend of that $5 trillion, we spend about 750 billion of it, close to $1 trillion, $750 billion on administrative cost. And today, how do we service that administrative cost? We do it with services. We do it with humans. It actually be with tech. And this is something that I so much appreciated at Amazon, and we tried to do it at One Medical before that. Basically, try to do it with tech. Like, how can you automate this? We're going to need the humans. I think in healthcare, we're going to need a lot of humans because as we get more information, as we ingest your MRI and CT scan and lab results, actually, it's much easier to say, get screened at this age, that age, or that age. the decision making is going to be more complicated, and we're going to need humans. Hey, Amir, you have a 17% chance of the next 3.5 years of this happening with these 3 potential side effects. What do you want to do? Well, the computer can help me calculate that, but what do I want to do? How do I make that choice? What about my kids? What about my spouse? How do I think about this? What are my functional capabilities? What are the side effects? I'm going to need humans for that. So, and if we don't, the access will be further constrained, right? And so I think it's just a tremendous, tremendous opportunity to make things better. I think with an investor hat, we like to say, as you started, our mission is healthier outcomes for all. I do think we can have healthier outcomes for all those key stakeholders, and for the people taking the risk to invest in these companies. I think there can be some big winners here.
This might be the most optimistic I've heard you when speaking about the sort of mission of healthier outcomes for all. And some of that, I think, is, where we are with technology and just the potential for it to really disrupt how care is delivered, how patients, the type of information. I mean, I'm so excited to be able to have a 360 view of my health that covers me for years. And then I can chat with someone that gives me peace of mind that I'm making the right decisions to take this test or that test. And I don't know, I match your excitement, because I think we're just starting to scratch the surface. And so the last question, and kind of we'd love to sort of end on this one on the podcast, is as you think about the big, bold bets that you're seeing at Healthier Capital, particularly kind of on the consumer side of healthcare, what's top of mind? Are there certain business models or area codes, insurance codes? I mean, what's interesting to you as you think of like big, bold bets in consumer healthcare?
Yeah, I think there's a few different ways to slice it. I mean, one way to slice it is take clinical areas where there's big gaps. So we have investments in cancer, I'll call it care management company called Daymark Health. We have an investment in a serious mental illness business called Amai Health, and a telebehavioral health company called Octave. And I know Maverick has some great investments in some companies in some of these spaces as well. So, I mean, that's one slice. Take cancer, for example, high cost patients, wide variation in care, wide variation in outcomes. Some of these drugs are hundreds of thousands, if not more, these immunotherapies. Delays in access. 50% of cancers are diagnosed at late stage. Like, that's a travesty, right? Stage 3 or 4. That's, so that's an area, and we're going to hopefully get a lot of new breakthrough drugs. And we talk about cell and gene therapy, and these things are going to be expensive. But if they work, that's great. How do we get them to people, get them consistently, manage the variation in care? How do we get people on goal concordant care? How do we manage side effects? How do we manage bounce back to the EDs? Who's there to accompany the person? Daymark, for example, if let's say a woman gets a suspicious mammogram, that time between that and waiting for your diagnostic memo or a biopsy or the appointment is suffering. It's terrible. They're like, let us come to your house today. We'll be there today. Let's talk through it. By the way, I'll order the genomics. We'll order the lab. I've talked to the cancer center. We'll start this. Then they'll have a conversation with the cancer center and the health plan saying, it looks like it's HER2 positive. Maybe it's Herceptin we should be doing. Is that what you guys would think? And let's get that going. And then we'll be with you the whole way through. So I think one lens could be in these complex areas where there's high cost or limited access. Obviously, spikes in demand in behavioral health from anxiety, stress, depression, family issues, adults, children, to serious mental illness, schizophrenia, psychosis, not well served in the current ecosystem. The current ecosystem isn't economically incentivized to serve these. Often employers have been struggling, consumers struggling. So I think that's one lens to look at it. I think we talked about another lens, which is kind of the upstream, preventive, longevity, could be primary care arenas. I think there's all kinds of tooling. We already talked about people engaging in different ways, whether it's with, various AI models, ChatGPT or Claude or Gemini. But what are the other tools that consumers will use? And maybe these tools can plug into the health systems and health plans, right? They might be B2B2C. We've seen some interesting things that will be the front end, maybe to that health system. Like, hey, I still might go to Stanford and want to go there, and that's a great brand. And maybe I can lob onto this. We did a little of that with One Medical, kind of partnerships with health systems, but you could see a lot of these tools being the front end. A little bit like this cancer example, Daymark. They have some tech, they also have some humans, but hey, let us handle that front end. We still need your back end of the experts of radiation oncologists and pathologists and surgeons and chemotherapy centers. So I think it's a wide range. I think the other driving factor on the consumer side is going to be the existing models are hard to access. The waits are long. And even with great insurance, the out-of-pocket is high, which basically creates a window of opportunity for somebody else to come in and say, I got a better thing than a 31-day wait, a $7,000 premium, $2,000 deductible, a $25 copay, and a 15% coinsurance for you to get your question answered. Like, that seems pricey. So, and then, we'll see what happens. There's some talk about, is there opportunity to grow individual insurance market? There's instability in the exchanges right now, but people talk about these ICRA, individual coverage reimbursement accounts, meaning the employer gives that $27,000, some pot of money, to the consumers, and you go just buy your own. So, but I think we're arming the consumer with more tools, but ultimately we're arming them because they have to pay a lot for the current system and the access is bad. And so if you can give me better access, better experience, less latency, I think the consumer is going to go in that direction.
No, I agree. And I think the consumer's smart, right? And so they're smart, and right now, it's, to your point, it's too expensive. It takes too long. And I think it's a fabulous, fabulous time to be building in this category, because the status quo can certainly be improved upon. And you now have tools that can address exactly those pain points, which is access, engagement, better care. So I'm super excited. I hope you and I can partner on something together, and so appreciate you coming on the podcast, and the best is yet to come, Amir.
Absolutely, Natalie, right back at you.
That's it for today's episode, The Maverick Mindset. Thank you, Amir, for joining us and sharing your perspective on building a company that has revolutionized the consumer experience in healthcare. Thank you for listening. I'm Natalie, and this has been The Maverick Mindset.